Skincare, evidence-based best practices. This brief presentation will cover the topic of preventive skincare, featuring evidence-based best practices supported by the National Pressure Injury Advisory Panel and the Global Incontinence-Associated Dermatitis Expert Panel. Good skincare serves several purposes. It promotes good personal hygiene, dignity, and a sense of well-being. It may also be protective in the at-risk population, helping to prevent skin breakdown that may be caused by frequent or repeated exposure to moisture and irritants from incontinence or other sources. Depending on the needs of the individual being cared for, there may be up to 4 steps to a good skincare program. Those steps include bathing with a mild, pH-balanced skin cleanser and moisturizing dry skin daily. For the incontinent person, a perineal care regimen is necessary. The pericare regimen is a 2-step process of cleansing the skin with a pH-balanced skin cleanser promptly after every episode of urinary or fecal incontinence, and then applying a skin protectant according to manufacturer's directions after perineal cleansing. Why is it important to use pH-balanced products for skincare? Healthy human skin tends to be slightly acidic. We call the acid nature of the skin the acid mantle, and this acid mantle helps to prevent harmful microorganisms from growing on the skin. Many over-the-counter soaps are alkaline, as you can see on the diagram. With regular use, they are likely to disturb the protective acid mantle. By using pH-balanced products, we support the acid mantle and help to protect the skin. Best practices for bathing and skin cleansing include using a pH-balanced product that mimics the pH of healthy skin, cleansing skin using a soft cloth, and gentle technique to minimize friction damage. When bathing in a shower or tub is not possible, rinse-free cleansers are an excellent option. The National Pressure Injury Advisory Panel recommends using skin moisturizers daily on dry skin as part of their pressure injury prevention points guidance. Dry skin areas should be regularly assessed for the presence of scaling, roughness, redness, and cracks. Documentation and follow-up of these signs are especially important when evaluating the effectiveness of your preventive interventions. Skincare for prevention of dry skin includes twice-daily application of moisturizers. This also has the potential to improve the skin's barrier function. Let's take a look at the key ingredients usually found in a moisturizer. Emollients hydrate and soften skin and improve its flexibility. Lipids from fats, waxes, and oils are common sources of emollients. Animal products such as lanolin, mineral products such as petrolatum and dimethicone, and vegetable products including shea butter, olive, corn, and canola oils are all sources of lipids found in moisturizers. Occlusives form a thin film on the skin to hold moisture in. Some emollients, including petrolatum, dimethicone oils, and lanolin, also have occlusive properties. Humectants attract water to help keep skin hydrated. Common humectants include aloe vera, glycerin, and sorbitol. According to the Global Incontinence-Associated Dermatitis Expert Panel, incontinence causes disruptions of the skin barrier function, triggers inflammation, and leads to superficial skin damage. With exposure to urine, skin bacteria may convert urea to ammonia, which is alkaline. With exposure to feces, enzymes capable of damaging the stratum corneum increase the potential for skin damage. With dual urinary and fecal incontinence, fecal enzymes can also act on urea to produce ammonia, further increasing the pH of the skin. Macerated skin also becomes more prone to injury from friction caused by contact with clothing, incontinence pads, or bed linens. Superficial skin damage is associated with pressure ulcer development. To prevent and treat incontinence-associated dermatitis effectively, caregivers must target 3 things: skin maceration, chemical irritation, and physical irritation, using the techniques of prompt skin cleansing and application of a skin protectant and gentle cleansing technique. Skin protectants are an essential part of a good preventive skincare program for the incontinent individual. There are many products to choose among, so it's important to identify the product that best meets the clinical need for prevention or treatment. Follow manufacturer's instructions for use of the product. Evaluate the effectiveness of the product. If the goal is prevention of incontinence-associated dermatitis, is the skin remaining healthy? If the goal is treatment, is the skin showing signs of improvement? Skin protectants are designed to shield the skin against moisture and irritants. They contain a specific combination of ingredients that usually includes an occlusive such as petrolatum, dimethicone, or zinc oxide. They form a thin protective film on the skin. Zinc oxide also has anti-inflammatory properties. As you already know from the information on moisturizers, some occlusive ingredients also have emollient properties. Those occlusives that act as emollients include petrolatum, dimethicone, lanolin, and oils. Humectants such as aloe vera, sorbitol, and glycerin help to gently hydrate the skin that's being protected. Astringent ingredients such as zinc oxide and calamine act as protein precipitants and cause shrinkage of tissue to help dry, oozing, weeping skin. In summary, good skincare promotes good personal hygiene, dignity, and comfort. It can also be protective for those at risk of skin breakdown. There may be up to 4 steps involved in a good skincare program. pH Balance products support skin health. Select a skincare product designed to meet the clinical need. Follow manufacturer's instructions for use and evaluate its effectiveness. We thank you for your time and attention to this program. Selected references are shown below.